Hello, everyone, and welcome to Nature and Science Podcast. For the next several episodes, we'll be focused on cancer care from the psychological, mental, and nutritional and clinical oncology aspects of cancer. We will also discuss the recent research that promises cures for some cancers. But today, we're excited to welcome Dr. Wendy Garvin Mayo. Dr. Mayo is a healthcare leader with over 20 years of experience in clinical practice, leadership, research, and academia. As the CEO of Collaborative Cancer Care, she's dedicated to transforming mental health support for cancer patients, their families, and oncology professionals. In addition, she's the creator of the Stress Blueprint, a consulting firm helping healthcare professionals manage stress through emotional intelligence. Dr. Mayo's contributions have earned her multiple awards, including the University of St. Joseph's Distinguished Alumni Award and the University of Connecticut's Outstanding Alumni Award. Congratulations. She's also an accomplished author of Shape Your Life, 5-Step Blueprint for Sustainable Stress Management. We can't wait to dive into her wealth of knowledge on stress management, mental health, and cancer care, and leadership in healthcare. Wendy, welcome to the program.
Thank you so much. I'm really excited to be here.
Well, Wendy, I want to start off by asking you what started you on this journey in oncology and healthcare. And as a recent cancer survivor myself, I've had a lot of interaction with oncology nurses, which I think that's where you began your career. And I can tell you, oncology nurses are the champions and are among the best healthcare professionals I've ever interacted with. So I'm really interested in finding out what started you on this journey.
Yes, so in nursing school, that's when I really discovered my passion for oncology. As a bachelor prepared nurse, we had clinicals where we go on different units to really explore and learn about different specialties within nursing. And my very first clinical was on our oncology unit. I remember it vividly. I remember walking in, getting my assignment, and I had a gentleman. I still remember his face, dark-skinned man from the South, big afro with yellow eyes. He had metastatic pancreatic cancer.
Well,
And this gentleman had about 13 children, he told me. And despite that, I was there with him. No one was there with him at the time. And I took care of that gentleman for a couple of times during my clinical rotations. And I walked out of there that first day and I said that this is where I'm supposed to be. And the reason I felt that is because I felt aligned with purpose at that time. And it was really an honor to be in his life, even though this gentleman was dying, literally dying from his cancer. I was there to make those days as bright as I could, whether it's through listening to his stories, whether it's holding his hand, whether it's educating him, whether it's just validating him. So that's where my experience in oncology first started, on that one unit with that one patient that I still remember so many years later.
that's just fantastic, that human interaction and contact. I mean, it sounds like you made a real personal, deep human contact with that person, and it's influenced your life to this point. Well, tell us what collaborative cancer care differentiator is. What is collaborative cancer care?
So collaborative cancer care, it is a practice that is really curated to provide mental and emotional support for cancer patients, cancer survivors, and cancer caregivers. We are truly revolutionizing mental health and oncology. Whenever you hear the word cancer, people think of death. They're afraid, they're overwhelmed. So many things are going on. So it really creates a shift in an individual's life, mentally, physically, spiritually. And collaborative cancer care, we are there to fill that gap, to really provide patients with the mental health and emotional health resources that they need. Now, what makes us different? What makes us different is a couple of things. One is we do have mental health experts who are social workers, marriage family therapists, psychiatric mental health nurse practitioners, who all have had some sort of personal experience with cancer themselves, whether
Mhm.
whether they are a cancer survivor, whether they were the cancer caregiver. So
Mhm.
that's one differentiator. Another differentiator is me, myself. I am an oncology nurse practitioner. I have taken care of patients with cancer, new diagnosis, ongoing diagnosis, taking care of patients on hospice to end of life. I've also have experience in the clinical trial space. What does that mean? What is clinical trials? So what makes us unique is we're able to not only provide them with the mental health expertise, but also help them with the clinical education, help them with advocacy. Because many times, Dawn, patients emotional instability is related to the unknown, not
Mhm.
understanding. And
Right.
healthcare can be so complex and so confusing. So we really help simplify that all here in one practice.
Right. Understand. So, what's your ultimate vision for collaborative cancer care? What are some of the major outcomes you'd like to see now and in the future?
Yeah, so right now, I would really love to see all oncology healthcare professionals prioritize mental health in the
Mhm.
patients they are serving. Not only the patients, but the caregivers, because it is a family affair when someone is diagnosed with cancer. I also would love to see collaborative cancer care across the nation or even globally, where we become a movement where people understand the importance of mental health in cancer care, but also do something about it. Do
Mhm.
something about it. That's where I see the revolution really going, is that we prioritize the mental health of patients, because it not only impacts their experience with cancer treatment, but it also impacts survival. It
Mhm.
impacts quality of life. It
Yeah.
impacts individuals from thriving. And as people may know, we're doing so great at keeping cancer patients alive, but are they living a good quality of life?
Right. So
I'm
your
going to say
past, yeah. So your past experience and personal knowledge and being so integrally involved at every level, has really positioned you to lead this effort.
absolutely.
Yeah.
Absolutely. With a team.
Yeah, with your team. Can't do it alone. So, how do mental health problems in cancer patients manifest? What have you seen?
Well, I see it manifest as worry, can't sleep, not eating. It really disrupts relationships. It disrupts livelihood. Patients are anxious, depressed. It disrupts their quality of life. They're not functioning. They're not able to really function and show up in the world the way they want to be seen. So it really is disruptive. But we see a lot of patients coming in just very anxious, nervous. They don't know. It's the unknown. They're scared, you
Right.
know?
Understand.
Um,
So
yeah.
fear of the unknown and leading to anxiety, which then manifests as eating disorders and all other sorts of things, relationship problems, probably not being able to relate to their spouse or mate in the same way, or their children or their extended family as well. Now, I understand some uh, cancer patients, I mean, they keep their cancer a secret and even try to keep it a secret from their spouses, and don't tell them the extent of their illness. And that's another manifestation, isn't it?
Absolutely. Many patients want to kind of handle it on their own. I had a patient even today saying, I'm strong. I can handle this, right? Patients come in with that perception, but they don't want to bother anyone. They don't want to bother anyone, right? Yes, they're going through cancer, right? They're trying to deal with it, but they don't want to bother anyone. And, I call it identity dissonance that happens when someone is diagnosed with cancer. We know ourselves to be one way. Society, people, family members, and friends expect us to show up one way. So how we should show up. And then it's like, who are you really? Who do you think you are, right? All of these things are in conflict because, when you're diagnosed with cancer, you don't want too much to change, right? You want to still show
Sure.
up, be strong for your kids, your husband, your friends, but inside you are dying
Hmm.
emotionally, mentally. And what I always ask patients, and this is how we get to the really the root of what's happening. I ask them, what is going through your mind when you lay your head on the pillow at night? That's what I want to talk about.
Hmm.
Not when you get up and get dressed and put on your nice clothes and put on your makeup or your tie or your suit and go to work, but that time when you're at night, when it's dark and you're laying in bed, I want to talk about those things.
Hmm. Understand. So that's one way to begin the process of the steps that caregivers like yourself can take in navigating mental health problems with patients. So there's that professional level, but then there's also the caregivers. And I assume you have to interact with them as well. And so, what do you tell caregivers in helping them to navigate some of the mental health problems uh, that manifest in cancer patients?
So for caregivers, I always start with you have to take care of yourself in order to take care of your loved one. You have to take care of yourself before you can really take care of your loved one, which is hard because for them, they have some of the same symptoms. And there was research done that showed that caregivers have higher stress levels than the patients who have cancer because they're
Right.
so worried.
That's
But it's
interesting.
taking care of themselves. It's getting involved in community. You don't have to do this alone.
Hmm.
You don't have to do it alone. There's people out there who are there to support you. So, one, accepting help because it's there. And many people are like, well, I don't really do that. But it's like, really, really get with community. And two, and three, understanding what's going on, having that education and clarity as to what's happening, what do you need to do, and being an advocate, not only for yourself, but for your loved one.
No, that that certainly makes a lot of sense. So, how involved should oncologists themselves be? I mean, I had two radiation oncologists, and I'm sure you're familiar with this, and of course, a chemotherapist as well. So, how involved should they be in fostering the mental health? I mean, they focus on, the physiological and they're, focused on, is this the right course of treatment? So, is there a more holistic approach that they should be taking?
Absolutely. I believe healthcare professionals in oncology should be all in. If you
Hmm.
are treating someone for cancer, you need to ask who needs to be on their team, who's their executive board, and it should include someone that's addressing their mental health. If a patient is newly diagnosed with cancer, whether it's a radiation oncologist, whether it's a surgeon, whether it's I had a gentleman who was diagnosed at his dentist, you should be referring them to someone for their mental health.
Hmm.
It needs to be a collaborative effort. Yes, you treat them physically, but we all know that a cancer diagnosis is going to impact someone mentally. We all, that's hands down. That's not negotiable.
Hmm.
You have to refer, you have to really build your team. So, what I would tell healthcare professionals who are in oncology is understand what resources you have for your patients. And if you don't have resources for your patients and you are listening to me right now, please reach out and I will help you find some because many times I don't think that healthcare professionals don't refer because they just don't want to. I think it's a number of things that really contribute to that, whether it's time, whether it's knowledge, whether it's having the resource to refer them out. So I think it's a number of things, but assessing mental health in patients should be part of every visit, not every
Hmm.
third visit, not just when they progress, every visit.
That's a
Every
very
visit.
that's a very good point. So some oncologists, more than others, perhaps are or have been trained in mental health. Do you think oncologists should be trained to some extent, or at least have a course or two, or a seminar or two, or maybe even an entire, half a year in their residency, their oncology residency, where they're dealing with the mental aspects as well? Is that important? I know that adds another level of responsibility onto an already difficult, burden for oncologists. But what about that? Should that happen as well?
It should definitely be included in the curriculum. So it shouldn't even be like a seminar or a course. It should be embedded in everything you're doing. You know,
Hmm.
you're learning about diseases and treating diseases, right? So how is this impacting the patient? So whether it's an oncologist or primary care doctor, you are dealing with people, you're dealing with lives, you're dealing with disease.
Hmm.
So not only educating, but think about it. And this is where like the emotional intelligence come in, but think about that person who's receiving that news or receiving that medication or who they're going home to. How's it going to impact them? Right.
Hmm.
So really kind of putting yourself in their shoes and having that empathy,
Right.
understanding what they need, asking them what they need, and then listening to what they're saying,
Right.
right?
No.
But it definitely needs to be embedded because even, we're talking about cancer, but, even a new diabetes diagnosis can be detrimental to your mental health,
No.
right? So
Absolutely.
blood pressure. I mean, high blood pressure. So, it's important that we are assessing mental health across the board, especially now in this day and age. In this
Hmm.
day and age, post COVID, I don't know if we're post COVID, but post 2020,
Hmm.
people are dealing with a lot. And one thing I do want to highlight is that we're talking about mental health and oncology, but I just want people to be mindful that before a diagnosis, people are living their lives with mental health diagnoses, with anxiety, with depression, with suicide ideation,
Sure.
with schizophrenia, with bipolar, right? And then on top of that, they get these diagnoses. Those things are just amplified.
Mm.
So something
Absolutely.
to be mindful of.
No, that's absolutely true. Well, we already talked about the fact that some patients see the cancer as a death sentence, and some, to the extreme fact. Is there something you tell them or you tell caregivers, specifically who just think they're going to die? I mean, I, was in a room with, dozens and dozens of cancer patients, and it ran the gamut. And some, had virtually given up hope, and even though they weren't that sick. And so, what do you say to them?
So my goal for patients we work with is not only to address their mental health, but also help them identify and align with their purpose and
Hmm.
have them understand that they still have so much to contribute to the world, their gifts. Cancer doesn't define you.
Hmm.
It does not define you, and that you still have so much more to give. And this. So I had one patient who was saying that he was diagnosed with metastatic prostate cancer, and what he said is he's just waiting to die.
Hmm.
And I said, well, what if this is your time to start living? And he said, I never thought about it like that. But every time you get out of bed and your eyes open, it is an opportunity for you to serve the world.
Hmm.
Cancer or no cancer, it is an opportunity for you to serve the world. Because despite what's going on in our lives, someone's waiting on us.
Yeah, I
Someone
love
is
that.
waiting on us.
Yeah, and I love the sense of giving someone a sense of purpose and telling them, regardless of the cancer, that doesn't define you. You can
Yeah.
serve, you can be of service, you can have a purpose in life. And so it's not about you reacting in a wrong way or in a negative way to cancer, but it's you having the right attitude overall to life itself,
Yes. Yes.
and that you're still living a miracle,
Yeah,
regardless.
absolutely.
Yeah.
And one thing I
Because
used
at
to
the
tell my go ahead.
I was just going to say, because at the end of the day, we're all going to pass away of something. So regardless, getting people in that space to understand that, because regardless, you could be saying, well, I'm waiting to die. Well, no, you're living from moment to moment, and it's a miracle every moment that you're alive. That's certainly the attitude I had when I went through my treatments, which thankfully are in the past now. So,
Yeah,
that's
absolutely. One thing I was going to say is one thing I used to tell my patients is you have cancer. Cancer does not have you.
that's a
You
good
have
way to.
cancer. Yeah. Cancer doesn't have you, you have cancer. So you are in control, right? So it really just kind of shifts the mindset around it.
Exactly. So I know you're not practicing as a oncologist nurse any longer, but and they're all different types of cancer. People need to understand that. I think in the degree of cure in is different for all these different cancers. But from your perspective and what you've seen over the years, what's the future of cancer treatment? I mean, is there hope overall for a future cure? Again, realizing that there are so many different types of cancer out there.
Yes, I would say I'm very hopeful that there is a cure, and people are living longer. So I don't know if you call that a cure, right? But people are
Right,
living. So it's kind of like what you focus in on. What does cure really mean? It's never
right.
going to
That's a
come
good
back. I don't
point.
think that's guaranteed, right? But
Right.
what is cure? I think it's more so really extending life is what a lot of cancer treatments are doing, that overall survival. How long are we able to keep patients alive? And we are extending that in many various cancer diagnoses. We are keeping people alive. But the focus has to be on, and even in clinical trials that are being done in oncology, and they're starting to do this too. But what is that patient experience? What's the quality of life of these patients, receiving treatment? Are we able to kind of track that? Because yes, you keep them alive for 10 years, but is it 10 good years?
Right.
Right? Or
Exactly.
are they debilitated?
Right.
So yes, I'm very hopeful that we will continue to really extend life for individuals living with cancer.
Well, it gives me a chance to introduce a book that my oncologist turned me on to because I mean, being a past medical researcher myself, I was very interested in everything having to do with the physiological and medical side of cancer. And of course, there's a book that you're probably familiar with, The Emperor of All Maladies. And it's interesting in that, particular book, it talked about what we were just talking about in terms of cures and future cures and that sort of thing, and how you define a cure exactly. But I want to mention to my listeners to, if they have a chance, to pick up that book because it gives a good history and overview of cancer and many of the things that have gone on in trying to find a cure for cancer. But one of the things that book brought out and talked about a great deal was the mental and psychological problems associated with children. On the one hand, children being so resilient and always hopeful, but then just the heart wrenching and difficult side psychologically of seeing a child go through cancer. Is there a major difference that you've noticed in your practice on the mental and psychological side when you're dealing with childhood cancer?
Yeah, so we don't see children in our practice.
Hmm.
However, when you're dealing with children, same thing. You need to ask and assess
Hmm.
because depending on that child, they may be okay, they may not be,
Hmm.
right? But also looking at the caregivers when you're dealing with children with cancer, because they are a part of that equation who are
Hmm.
also, suffering from a mental and emotional hardship related to the diagnosis. But children, like you said, are very resilient, especially when you're talking about very small children. But
Hmm.
we're seeing a rise in, cancer in younger people. So we're talking about teens and even early 20s.
Hmm.
So those individuals, and we already know at that age, there's already that so much comes with that, that, assessing mental health is even that more important.
No, absolutely. And I was going to ask you about that because it's certainly all in the news everywhere right now that there's been an uptick in cancer in younger populations. In fact, my daughter mentioned it to me first before I even heard some reports on news and read some of the medical papers on it. Um, but in your experience, so have you experienced in your practice that uptick, particularly in women of color? I think that they were saying. and any sense of why that is. I couldn't find any real scientific information in any of the papers as to why that we're seeing this uptick.
Yeah, so we are seeing it. Breast cancer and Black women. We're seeing colon cancer and in younger people, not really defined by race. But I think it has a lot to do with just our environment, our lifestyles. And what I always think about is like, think about the things we can control. So I'm a big advocate for what is your family history?
Mm-hmm.
Understanding your genetic makeup is so important,
Right.
especially in, the African American families. It's not something, we always talk about openly, right? We don't know why grandma, great grandma died. We have no idea, right? But having those conversations and making like normalizing those conversations
Right.
of medical history, who has what, genetics, normalizing going to the doctor for your wellness visits, normalizing screening, right? Getting even your eyes checked, getting your dental appointments, your breast exams, your testicular exams, your prostate exams, your colonoscopies, your skin checks, like normalizing these things and holding each other accountable is so important, even as young people, because
Mm-hmm.
that's where it starts, right? You got to
Right.
kind of normalize it now, because health is so important. When we don't have our health, nothing else matters.
No, absolutely. Well, I just wanted to mention to our listeners too, and I think our regular listeners know we just did a podcast on genealogy, and we had a section where we talked in great detail about the importance of understanding your genetic profile in terms of your mental health and how important that is. And even to some degree, it becomes controversial because people don't want to know. And so you talked about normalizing it, and I think we do have to want to normalize it. And that's what Micah Anders, who was here talking about genealogy, is helping people try to do, is to normalize that aspect of it. And our next podcast following you is with Kira Deneen, who counsels people on genetic diseases, mostly young mothers who may either have a genetic disease themselves that they may pass on to their babies. She counsels them and helps them make decisions and also tries to normalize this. So we're going to have a whole series on this, including having my oncologist on. I'll be talking to the doctors and asking them some tough questions as well. My dietitian, nutritionist at the University of North Carolina will be on speaking on the issues of nutrition and cancer and the importance there as well. So as we wrap this up, how do you see the future of mental health, mental health in cancer treatment? Are you encouraged by the work that you're doing?
I am very encouraged and I'm inspired because we are really empowering patients in community. We don't just work with patients who come to our clinic, but we're out in the community. So
Mhm.
we are really, planting seeds to have, individuals feel empowered to
Mhm.
bring it. If your oncologist is not asking you, you ask them.
Right.
Taking that ownership, being an advocate for yourself. So we're working both ends. We're talking to the healthcare professionals. We're also talking to the patients so they could be empowered. And community, caregivers are essential and pivotal in this experience where, maybe the person who is diagnosed can't really advocate for themselves. So the caregiver, ask the questions. Make sure you get the answers.
Absolutely.
And if you can't get the answer, make sure you partner with someone who can help you get the answer, right?
Oh,
So
that's
that
that's
community is very important.
that's a very good point. Well, just to drive that point home, and I don't want to personalize this too much, but it really helps make your point with respect to questioning. And I certainly, when my two oncologists were together and trying to find a course of treatment, I could see right away that they didn't agree on the course of treatment. My oncologist that was the chemotherapist felt it was necessary. I think my radiation oncologist reading, his body language and attitude wasn't so sure. However, the important thing is because I was questioning, I developed a really good relationship with my chemotherapy oncologist. And actually, I was supposed to have 6 or 7 treatments, and we got halfway through the treatments, and he said, I don't think, this course of treatment is really necessary, and it's probably going to do more harm than good. And so I'm going to end this course of treatment. Interestingly enough, right after that happened, because I'm constantly reading scientific papers, I read a scientific paper by some doctors in Australia who were talking about de-intensification of cancer treatment and how important it is that oncologists understand that now the research is showing that some of the protocols call for courses of treatment that are not really necessary anymore. So to put an even finer point on it, when my treatment ended, I had developed this great relationship with my oncologist, and he just said, Don, I have to tell you that we developed these protocols because, as you know, and he said, you read the book I gave you, and I said, right, and he said, well, some of those protocols were developed way back when, and we're still doing them today, and no one has asked why. Which even brings forth the other question of how do you mentioned clinical trials, new clinical trials that are saying the protocol should be different. How do you then get the clinicians to accept those new protocols and to overcome patient resistance, which is also a problem because some patients who are afraid that they're going to die, the psychological aspect then leads them to say, well, I need more chemotherapy. More is better. Even though an oncologist may say, well, I don't think, we need to have this intense of a protocol of treatment. But starting off with answering questions, having that sense of community and people working together, getting more knowledge, knowing that you can be involved in the decision-making process really helps your mental health because the more involved you are and the more in control you feel, I think the less afraid you are, the less anxiety you have, and the more secure you feel about what's happening to you because of that sense of control. And it all begins with I think, with questioning and interacting. So that was great advice on your part.
Absolutely, absolutely, and that just makes me think. Don, you yourself, you're a great advocate. So even people becoming in close proximity with you, who's full of knowledge, right? So they can ask the right questions. So yeah, that's amazing.
Yeah, and I'm going to be involved. That's why I'm doing the series on cancer, and I'm going to actually take this out into the broader community as I cultivate more understanding and knowledge about these things and get more and more people questioning and knowledgeable about their mental and psychological as well as their physical health. Well, Dr.
Yeah.
Mayo, this has been a wonderful conversation, and I've really enjoyed having you on the program. Thank you so much for joining us on Nature and Science podcast.
Thank you so much for having me.
Thank you for joining us on Nature and Science podcast. Next week, the podcast is all about genetic counseling. Kira Deneen joins us to discuss the challenges surrounding genetic diseases and the sometimes difficult decisions parents have to make. We will also talk about the revolutionary gene editing tool CRISPR, that is, clustered, regularly interspaced, short, palindromic repeats. What does that mean? Join us to find out. Please don't forget to hit that like button and subscribe at natureandsciencepodcast.com. As always, stay safe, share happiness, and remember, never stop questioning. Curiosity has its own reason for existing.